get started, we can get out of here. You guys get to listen to me today. Sorry. But we'll start off by saying thanks to everyone for coming, and let's start off by patient success stories. Have anything that they want to share? I'm gonna make the audience participate. Just so you know. Any patient success stories?
Oh, this is a success as much as just a good overall compliment. I met with a patient outpatient, and he just had nothing but wonderful things to say about our hospital facility as a whole, especially as outpatient physician. He's from California, and mentioned that historically he's done a lot of his healthcare out in California, but just says he is very dissatisfied with healthcare overall out there because it's not as patient-centered. Here he said he got a lot more time with his provider. His provider went with him, he got a lot more in depth with him, and just gave him a lot more face time and explanation. He said just point blank, I'm going to be getting the majority of my healthcare here when I'm here versus in California.
That's great, and that's the time of year we hear that a lot, when people are out here for the summer, and I had the same conversation with somebody different on the phone who they go back to California and they just enjoyed everything about this. So, everybody, we were supposed to have a skit about infection prevention, but it's not here, and I don't know the skit. So, just make sure you wash your hands. Everything you touch is dirty. Everything, I promise. This I'm touching right now, I'm sure is dirty. I'm gonna wash my hands after. Okay. I'm going to quiz everybody. I think we're going to get this great. So we have different security codes throughout the facility, right? So overhead cage, if somebody says code red, what does it entail? What does it mean? Fire. Fire. Awesome. Okay. How about code yellow?
Security.
Close.
Code yellow is natural disaster.
Natural disaster.
Urination.
Yes. Who said disaster?
Hayden did.
Disaster. Yes. Disaster plan. Code pink.
Yes.
Code green.
Security.
That's a lockdown.
It's lockdown. It's lockdown.
Security code.
Security, okay, we'll get to security, but code green is campus lockdown. Silver. Yes, wandering patient, yep. Care center resident. Blue, good blue. Yep.
That too.
Code purple. Yes, good job. HIPAA violation. 999.
What?
That's security. 999 is security.
That is
Yeah.
brand new. No one has ever told us that.
So, there they are. We have almost all of them. That's awesome. And I even, with the code team, I didn't know that. I learned a lot. But those are our codes, and you can hear those overhead. We do our annual training. They go over these as well. Patient experience stories. These are some words that were used when describing their care. Good, great, excellent, attentive, kind, happy. A lot of great words in there about the care. There's some patient feedback. We have Princess Katie. There's another one saying that they've kind of been all over Salt Lake, Arizona, and Texas, and it's best care they've gotten. Best hospital and staff have ever been at. They should get the AAA rating. So this gets back to the hospital. And the doctors, nurses, and hospitals are second to none. We go from Arizona to Star Valley to see Dr. Burke, and they were successful on the trip. And they had a very stressful situation, visiting from out of town, had an ATV accident, and the entire staff was okay. So good job, everybody. And then, again, this is not just one department, this is every touch point the patient has, when they have good experiences like this, which include everybody. Awesome job. These are our scores, so from Press Ganey for patient satisfaction, we are done with the time frame. It was from April through June, and so these are the completed scores. Ambulatory surgery, I'm going to point out a couple different things here. Right here, it gives you a kind of a quick year in advance look, and if you look at our score, it's gone up since last year. So we went from 79.1 back to 82.7. That 82.7 is the amount of people who scored us very good. So 82.7% of people scored us very good. Our percentile rank means how we rank between other facilities, and as you can see, ambulatory surgery is very competitive. So obviously, to get a higher ranking, you're going to have most of them, probably 90% plus in the area. So we're increasing substantially, so that's awesome. Emergency department, you can also see, has gone up since last year continuously, every quarter. We went from 76.3 to 83.6. So you can see that 80.6% of people are rated us really good, making some difference, even though the top box ranking is pretty close between the two. The emergency department is a little bit less competitive because we're in the 95th percentile rank for all the other facilities, which is awesome. Inpatient, 72.5% of people ranked us very good. That's the 90th percentile rate. Again, if you look at the year in advance, it's gone up each quarter. And medical practice is the same thing. So in every area we have gone up over the last year. So great job to everybody. 81.2% of people rated it very good. And again, that is looks like a very competitive area. As I said, it's a little bit lower, but that's still most patients rated us very good, which is awesome. And the sample sizes are great. We see 425 people responded, which is awesome. So our scores are looking great. And I like to see these green triangles making an increase again in every area. So our financial update, bear with me getting the financial update. So does anyone know when our fiscal year starts? July 1st. So this is, we are now in fiscal year 20, and so this is information for fiscal year 19 and 18 in comparison. So if you look up top, year to date was for fiscal year 19, year to date, and then last year to date actual. So we're up in inpatient admissions by 3%. We're up in surgery visits by 3%. Our ER visits are down by 11%. Urgent care visits are up 69%. That is because for fiscal year 18 we started late. But we are capturing a lot of patients in that area as well, and then our clinic visits are down 2%. So then it goes into our budget. We budgeted for in fiscal year 19 and what we actually have. So the main thing that I want to point out is the negative means we didn't hit what we actually budgeted, obviously. And in comparison to fiscal year, is the right side here, is in comparison to fiscal year 18. So although we were up in comparison to fiscal year 18, we still didn't meet what we had budgeted, if that makes sense. For that top gross operating revenue, and same with operating expense, 11%, we didn't meet. Overall, for fiscal year 19, the biggest thing I want to point out is the year-to-date actual loss, 1.6 million. We budgeted to have a loss of $1 million. So we're off quite substantially from that goal. And that's where you get this variance, these two variances there. Down below, days in AR, we're right at 50. We want to be there or below. Cash on hand, we did dip below 90, which 90 or above is our goal. So it wasn't a great year. Yes.
Sorry to put you on the spot, Tori, but, so I know it says that the chapter in the past said that the 90 days cash on hand was actually a requirement for some of our loans. So since we're actually 72 below that, what does that mean for us? Like, do we get a higher interest rate? What does that mean? Why, since we're obviously not meeting that 90, what's,
Chad, how do you want to answer that?
The Wells Fargo, they take our financials semi-annually, December year-end, or December and June, to take their calculations for the covenants. We do have a 90-day liquidity covenant where we have to maintain cash on hand of 90 days or more. When they ran the financials for our December numbers, we came in at 87, I think it was. And so we were below that covenant, and so we were in fault of that covenant. And so I got a nice letter. He warned me, Brian, our account manager, warned me that he would have to send a letter to us saying we were in default of a covenant. And they waived the covenant default this time because we don't have any other defaults. That was the only one that we had. So they waived the default, and they'll run it again in June. And as you can see from the financials, we'll be below 90 again. And so he'll probably send me another letter, and maybe they'll ask us more, maybe for a plan of action or something this time. But when you're in default, they can ask for your loan and full payment of loan and interest due immediately. But I'm not worried that Wells Fargo will do that, because this is the only covenant that we're in default on, and we've been making our payments timely, so it would be of no interest to them to call us on it. So that's kind of where we're at with that. That is the only one we're in default on.
Thank you. That was a good question. Thanks, Sarah. So we have a couple of talking points on what's different this year. Why are the numbers this way? So here's a quick summary. Our charity care and bad debt both went up substantially. So you can see that we increased our charity care by 107% and bad debt was up 43%. So between the two of them, it was almost $3 million difference. Our payment from Medicare and Medicaid, they did refuse to pay for some services provided, and it was 8.5% higher than we anticipated, which accounted for a little over $1 million. And our care center, our goal is to provide high quality long-term care. I think we have seen that with all of the great ratings that we've gotten in the care center and all the awards that have been received. But we do subsidize the care center at an estimated $1 million a year. And then we did focus a ton on recruitment of local people this year. We decreased our traveler use in a lot of areas and hired from within the valley, people moving to the valley. And we have put that out on a lot of different avenues to get those people here. And so we did increase that. More than $3 million was used, invested in wages to make sure that our wages are competitive. And there's over $30 million spent in salary and benefits, and we pumped over $100 million into the local economy this past year. And then we did put a lot of investments in making sure that we had good provider access. So we have hired a lot of providers, primary and specialty care. We've added 7 additional positions and physician assistants to make sure that we have enough providers to care for the community. So, because of those financials, there are a couple of things that we have initiated to try to kind of offset that. Just down for a sec. And so we've talked to the directors about this already, but if it's news to you, or I'm sorry, I'm just getting my page here. Okay, so we have, each director has a goal this year of trying to decrease their budget by 2% or make a revenue up of that 2%. So they have the year to do that and look at projects of what they can do to decrease it or increase revenue. For right now, anything that was approved on the capital budget, we're going to put a hold on unless it's absolutely necessary. If you have a piece of equipment that's broken or things, or a patient safety issue, obviously we'll go proceed forward with it. But if not, we're going to put it on hold for right now. And we're going to not do any travel unless it's absolutely required. So if you have a requirement for your job that you need certification, obviously stop you from that. But if it's just a course that might be good, we're going to put a stop on that for right now. And new positions, we've just asked the directors that if it's already been approved, obviously we're proceeding forward. I'll give you an example, like respiratory, we're been looking for a respiratory therapist for 6 months. We're still proceeding forward with looking for one, but just to look and make sure that that's really a position that we need. If it is, obviously we'll move forward with it. And then unless a new position creates revenue, we won't be creating any new positions as of right now. So that hopefully will see a turnaround. We'll see an increase in surgery and inpatients over the last few months. That they were up for the majority of the year, and then over the last couple of months they have been decreased. So we hope that it turns around. Do you want to add anything else, Chad?
Well, you did a fine job, Tori.
Okay, I am sorry you had to stick with me through that. Now I'm going to turn the time over to Sarah, and she's going to talk about insurance.
Hello, everyone. All right, so I get to talk to you about actually all of our benefits here at Star Valley Health. So just to name them, or you can read them. So we have PTO, short-term sick if you're a full-time employee, medical insurance, vision insurance. Joel, your has card got flipped around. HSA card, the dental insurance, short-term, long-term disability, life insurance, retirement, and wellness. And we're actually going to go through each of these so that you can just look at, the hospital does, I mean, all the wages were increased for that, but we also want to show you additional benefits you get, that the hospital gives to you above and beyond your salary. All right, so PTO. So if you're a full-time employee, day one, you start accruing 6.16 hours of PTO, which equals 4 whole weeks in a year. Does anyone know when that starts increasing?
5 years.
5 years. Then how much do you get? Yeah, 200. And then there's one more increase at 10 years. Hayden, I love that you're just holding up your hands. This many numbers. Then it goes to 240. And if you're not aware, if you're a new employee, you can only carry over at the end of the year, you can only carry over how much you earn. So the first year you don't have to worry about losing any PTO, but if you don't use it and the next year you have 200 hours of PTO on January 1st, you're actually only you're gonna lose 40 of those hours because you can only carry over what you earn. So you just be aware of that. January 1st, you can only carry over how much you earn. So if you earn 160 hours, that's how much you carry over. 200, you carry over 200. Does that make sense?
Can you cash out?
After you have been here for 5 years, you can cash out up to 40 hours in 1 year. Great question. Any other questions on PTO? All right. So everyone makes, I just put this in here, everyone makes more than $10 an hour. It doesn't matter what position you have, you're going to be making more than $10 an hour. So that's an additional $400. 40 hours, yeah. So that's an additional $1,600. And then short-term sick is the same. If you're full-time, you're in short-term sick, you get 40 hours a year. You also can only carry over 40 hours into the next year. You cannot cash out your short-term sick. You can't donate your short-term sick. So if you're not sick, sorry, you do lose it at the end of the year, up to 40 hours. So that's an additional $2,000 paid, potentially, just in additional benefits for you to take time off and go have some fun. All right, so now we're gonna, did I miss something? Oh, no, they're in different orders. All right, so now we're gonna talk about insurance. I actually called around to the different employers in the valley just to see how we kind of compared to them. So we have, if you look at the top, Star Valley Health, we have a $750 deductible or a $2,000 for employee only. All of these, the county school district, their deductible is $2,500 or $3,500. This is their co-insurance, so we have a 90-10 split if you come here, 70-30 if you go anywhere else. These guys, since they don't work here, they obviously only have an in-network. So you can look, some are better, some are worse. I think we're actually pretty average with what the other employers are offering in the valley. So just so you're aware. So we're gonna, on the benchmark, so our broker every year comes back and says, hey, your employees aren't paying enough of your insurance premium. And we come back and say, well, we think they are. But they are like, well, here is the data from all the other facilities. So if you look, we actually right here, whoops, wrong button. Right here, so we have you pay 12% of the premium. And in the Rocky Mountain, most companies do 20%, health services is 28%, and then hospitals 500 plus, or they make them pay 19% of the premium. So, and then employees plus contribution for family, we do 15% if you have anyone else on your insurance plan. And then they, again, 30%, 52, 24. So compared to other businesses, for your actual premium that you pay monthly, we're actually pretty, we're pretty good. Hospital doesn't make us pay too much. So, and then this, so the PPO plan, so this is the low deductible plan of $750, and then this one is the high deductible plan. So you can see if you chose the high deductible, you only pay 9% of the premium, 11, and then the contributions into the HSA. Yes, we put money in there. 85% of people in the Rocky Mountain, employers in Rocky Mountain do that as well, but not so. We're actually pretty good. If you look at the employer contribution amount right here, so if you're an employee only, the hospital puts in $500 on the HSA card for you, $1,500 if you have anyone else on your plan for family. And you can see we're actually, for family, we are actually very, very, the hospital is very generous on what they will put into the HSA for you. So, any questions so far? All right. Okay, so now we'll actually get into an individual for the premium. So this is what comes out of your paycheck. So the total monthly cost is $849.55 if you're an employee. If you put anyone, if you have your family on there, the cost is $2,456. Of that amount, if you're just an employee, you only pay $80 or $273 of that dollars. Now, who here has heard of self-insured? You heard that term? Who knows what it actually means? All right, so self-insured is what our hospital is. So what that means is our hospital pays for every single medical claim you have. We pay UMR a fee so that the claims are sent to them, they reprocess it, and then they write a check from our bank account to pay that medical claim. So when we say that it costs $2,456, we have to pool all that money together, and that's how the hospital actually pays your medical claims. It's not that UMR pays it and that we're gouging you with fees. It's the fact that the hospital is paying for you to have any medical care. And that's for everyone. Does that make sense? So we are self-insured, and that just means we pay UMR to use their network, and they do the repricing so that we can get better discounts than trying to go to every little provider that everyone can see. There's thousands of providers, and try to contract with them one-on-one. So that's why we pay UMR. So, but for the whole year, if you're an employee, you pay $960 for a year, and or $3,276, and the hospital is putting this much money, $26,000 into the insurance fund, or almost $9,000 into this. So what this means is in 2018, the employee, for what we collected from you guys out of your paychecks was $565,000. The hospital put in $4,362,000. So that equals almost $5 million into this fund to pay insurance claims, okay? And the reason we do this is because we have our brokers, and they go through and look at our experience, look how many people use our insurance, and they kind of estimate, all right, this is the trend, this is how much money we think you're going to need to pay the insurance. And this is actually how it came out in 2018. So we have insurance, and there's a reason why we have insurance, because when something comes up, we want to make sure that you are covered and not stuck with a huge bill. But so if we bring that number back in here, the hospital itself, or not that, so these are the claims. We paid $4,814,000. That's how many medical claims that came in for all of our employees. We had to pay UMR $846,000, so together, that equals $5,661,000. You guys remember how much money we actually collected in 2018? Yeah, almost 5, which means we had $732,000 in medical claims that we had not budgeted for. We hadn't actually put money in there for. And so, because of that, that is the reason why our insurance premiums were raised a little bit here in 2019. We don't really hate you and think that we need to take more money. It's our experience. You know, how many of us know of the baby that ended up life flighted because of problems, or really anything, the wellness visits, everything, all of those add up. And then we are so glad that we have insurance, but this is the reason why we had to increase the premiums. So, our experience is our experience. We can't change our health, right? We can try, but it doesn't really, accidents happen. We know they happen, and we just want to make sure we're able to cover those without any problems. Any questions so far? No? All right. Any blank stares? Is anyone sleeping? Okay, just checking. All right. So, nationwide, we actually have 22.7% higher claim usage than other hospitals. I'm not sure why that is, but with UMR, all of their hospitals combined, they looked at our demographics, and they're like, you actually should be 22.7% lower on your claims usage. But we aren't, which is why we have but that's the insurance we have. So far this, I brought in last year's numbers again. All right. So with the claims, if you look, this number right here, so of that $5,600,000 in claims, employees paid $661,000. So whoever met their out of pocket, went to their doctor, went to deductible. That's how much we as employees paid. But the hospital had paid $4,814,000 in claims. So in all, we averaged about 14%. So we averaged paying, as employees, we averaged paying 86% or 14% of the claims billed, and the hospital paid 86% of that claim, which I think is pretty amazing, because that averaging out, that's better than 80-20, and for whoever had to go out of the hospital for services, or even in network, I think it's pretty great. All right, vision. Did you guys know the hospital pays 100% of vision? Like, we don't add that into the medical premiums that we collect. As you can see, that's all used for medical. So, vision, I think it's a great benefit. On average, we pay $3,000 a month, and so that equals around $37,000 a year in additional benefits just for vision. And all you have to do is make sure you have to elect medical to get vision. We don't do vision standalone. The HSA card. All right, so if you have a high deductible, you get the HSA card. Now, it's not a match. The hospital's just going to put money on this card for you if you elect to have an HSA card. They'll put $500 a year, which we actually do it throughout the year, so you get $19.27 a paycheck. Or if you have you and anyone else, which is so a family member, then you get $57.70 a paycheck, which equals $1,500 in a year. It gives you an awesome tax break, so I put in like $50 extra into my HSA to help pay with medical bills, but really because of the tax breaks, it only cost me an extra $40, which is pretty awesome. Overall, the hospital put in $263,000 into HSA cards for you to use back into medical, or vision, or dental. It doesn't matter, you can use it for any of those. So, I know we had to raise the premiums, but the fact that the hospital turns around and gives you back part of that to use for medical reasons, is pretty awesome. Dental, we are actually fully insured. They tell us what to pay, we pay them the money, and then they'll pay whatever claims come through, doesn't matter how much. They look at our experience and they pay it. If you're an individual, the cost is $43.75, and you pay $7 of that. If you have a family, so 2 or more, it's $133, and you only pay $21 of that. And this is for a whole month. So for annually, you pay $84 for dental or $255, and the hospital is paying $441 or $1,300, which is pretty amazing. So overall premiums, us as employees, we paid almost $48,000, and the hospital paid $233,000. Total of $280,000. Long-term, short-term, disability, and basic. I grouped them all together. If you're a full-time employee, the hospital pays for you to have these benefits. It's pretty awesome. The short-term disability, I cannot believe how many people it has helped this year alone. We're here in July, and we've helped a ton of people that, I mean, if we left our long-term sick policy in use, they would be lucky to have a week, and then they would have nothing. And so the fact that our short-term disability is paying you 60% of your income, if you have a baby for 6 weeks, this benefit is very, very awesome. So since they're paid 100% by the hospital, this is what we average a month: $6,800 for long-term, $7,700 for short-term, and then your life insurance. If you're you get $50,000 in life insurance and accidental death and dismemberment if you're a full-time employee. Any questions on those benefits so far? Yes, Kelsey.
Go back a slide to the insurance ones. So these ones, is this kind of like how we're self-funded, so the hospital pays for it, or do we pay the insurance agency and they actually pay the 60% of the wages? How does that process work?
So this is fully funded. So we pay this premium. We're going to pay this premium all through the year, and we looked at the difference between the premium and how much we paid out in long-term sick to see which would benefit us. Some years it does, some years it doesn't. So we're hoping it's okay. And so we just pay them, and then if anyone needs it, they have to come to me. We fill out a medical a claim form and send it to Lincoln, and Lincoln will pay them directly.
Okay.
And then Lincoln will also issue you, it is claimed, it is money earned, so they will offer you W-2 at the end of the year.
Okay.
Great question. Retirement. So after you've been here for a year, if you've worked 1,000 hours, the hospital will start matching 6% of your income. So if we go back to this $10, we'll just make it easy, $10 an hour, because everyone makes more than that. Then if I contributed 6% of my income would be $48. And then the hospital would match that at $48. So together, $96 a paycheck would go into the retirement. For the year, I would end up putting in $1,200, and then the hospital's match, so I'd end up with $2,500 savings. But that's not including the interest and all of that you get when you invest your money into there. Currently in our retirement, the retirement that is just money that the hospital has put in there as a match, there's over $5 million sitting in the retirement waiting for employees that the hospital has just put in there, which I think that number is astounding and amazing. And there's even more in what the employees have in there, because some people decide to put in 10% because they want to really prepare, or they haven't prepared in the past, so they need extra. And so the hospital still will only match 6% though. Any questions on that? All right. Plug for wellness. Go Troy. All right, so how many of you guys know about the wellness program? It's super, super easy. All you have to do is go online to guidance resources, And you answer a questionnaire for your health, I always hit that button. For the health assessment, the hospital's gonna give you 15 bucks. All you have to do is fill out a questionnaire. The hospital pays for you to have your wellness blood draw. Go do it, enter it here as your biometric screening, another 15 bucks. You can do online coaching, up to 2 of them, you get $10 per each one. Healthy activity, the bowling, the loadage, any of that type of thing, you get another $15. Service project, $15. The health challenge, the steps challenge we just got done, if you participated in the steps challenge, seriously, go online to guidance resources and you just enter in there that you did the steps challenge, and we're gonna give you 20 bucks for that. So you can earn over you can earn $100 a year that we're just gonna pay you for doing these awesome activities. And then so in 2019, so far, we've paid $3,530 in incentives. And then in prizes so far, because we do the drawings if you've completed these things within a certain time frame, that we've given out $900 in prizes. Last year, we paid almost $6,000 to employees for doing wellness, and then $3,500 in prizes. So definitely a benefit. And literally you just have to go online and enter it. It's super, super easy. The incentives are paid on your paycheck the month after you do them. So if I did my activity here in July, then I won't get paid for them till a second paycheck in August. Does that make sense? Any questions? All right. So, totals for 2018. This, to me, was astounding. I couldn't believe, I knew that we paid a lot, but I didn't realize we paid this much. Look at that. So PTO. Oh, yes, Chrissy.
Hey, will you go back to the other page for a second?
Uh-huh.
Down in that bottom corner, it talks about the Air Methods Advantage membership. I was just reading that. Is that accurate?
No. So this was printed at the first of the year when Air Methods thought that we actually did. But then starting the first of the year, so this had to be made and put to guidance resources to comp site before the first of the year, and at the first of the year, Air Methods decided they're no longer offering the membership program. All right, so 2018, hospital paid $1 million in PTO, 165 in short-term sick. Yeah, look, medical, $4 million, vision, 37, HSA, 263, dental, 233. Like all of these numbers, retirement, 669. You can see that employees put in 983, so there is some that put in more than the 6%, which is great. 9,000 in wellness. Our holiday bonuses that we got, $130,000. So, and if you think just this payroll, this is just salaries. This does not include the payroll taxes that the hospital pays for you guys to have, but $22 million in salaries last year. So, total, Star Valley Health has contributed over $7 million just in these listed benefits. $7 million. And then if you think of that, 22, that's a third more that you get just in benefits. So I'm actually going to break that down into employee individually. So if we went back to this $10 and you would earn, your gross salary would be $20,000. If we just added up the benefits that you got, those ones that we listed, the retirement, the health insurance, all of that, you can get an additional $33,000 in benefits. That means together your take home in your paycheck is 20, but with that, you're gonna earn $53,000 pretty much, just in benefits. And then if we average it for all benefited employees for 2018, that $7 million, you average, the hospital paid an additional $25,600 to you in additional benefits. Any questions on that? Sorry, I know it gets long and technical and a little bit warm. All right, so, and then I just wanted to throw out a little bit of employee perks in case you were not aware. If you have a membership at Peak Fitness, if you tell them you're a hospital employee, they will give you 30% off of their monthly fee if you sign up for a year. AT&T, also, just let them know you're a hospital employee. I actually participate in this one. I get 22% off of the monthly charges on the very first line. And then Verizon says you can also get 22% off on their shared plans. And first responders get great discounts everywhere. So, any questions for me on any of the benefits? Pretty amazing, right? All right, Mike, it's you.
Can you tell Sarah loves the numbers? Do we have anybody here this is their first time at an all-staff meeting? No newbies today? Okay, good. I wanted to introduce to you all of the new hires that we've brought on to Star Valley Health in the past month. Just so when you see them, if you offer them a warm welcome to Star Valley Health and get to know them. So Shay Erickson is a CNA at the Care Center. Eric Pantuso is an aide in therapy, and he's a temporary summer aide. We have Cheyenne Labrum as a CNA in the Care Center. I hope I'm saying these properly. And Cindy Larson is a clinic coordinator in our physical therapy. And she is down in the Thane office of physical therapy, Cindy is. Jennifer Gunter, a patient account specialist in the revenue cycle department. And Maximo Vicente is in our environmental services. Here's a list of open positions that we have. And so if you know anybody looking for a job that would be qualified for any of these, please send them our way. We'd love to talk to them. If you can see, the list actually has gotten smaller. We have quite a few PRN listings there, but the full-time positions are actually, that list is getting smaller, so we're really happy about that. So I wanted to take just a minute this morning and cover with you the results of our 2019 strategic plan for Star Valley Health, and kind of what came out of that and how we did on our goals as an organization. This was reported to our board yesterday in a board meeting, and I just wanted to share with you the results of these main goals that we set for ourselves as an organization last year. So this one here, improve patient process to achieve best patient care. We feel like we've done a lot of good work on that. We didn't quite get to 100% of the goal, but we feel like we've done a lot of good work in that area, and we'll continue to refine and work on those things in the coming years. The next one, and this is all patient focused goals that we had. And, the next one is identify and implement best practices and applicable standards. And as you can see, we didn't quite achieve 100% of the goal, but we feel like we made a lot of great progress, and we'll continue to work on those things. Our evaluation of ACO participation, if you're not aware, we evaluated and we joined an ACO in 2019's fiscal year. And we're really excited about that. As a matter of fact, here over the next several months, the ACO team for Star Valley Health will be coming to each of your departments to give you some additional information and training about what is an ACO and why does it matter and why are we doing it. We really would like all of our employees to understand the why and how important participating in an ACO will become to us as an organization in the future. The next area is people. What that we set goals for in the last fiscal year. We evaluated the compensation and benefits for our employees. We feel like we got really close to finishing that up. As you know, we invested a lot in additional compensation for our staff this past year. As Sarah mentioned, is nearly to the tune of $3 million in additional compensation for our staff members. So we felt like we became much more competitive this past year. And we'll continue to work on the benefits and make sure that we are competitive in the benefits arena as well. Enhance and improve communication at all levels of the organization from the previous year. We felt like we got about 3/4 of the way there. We did a lot of work on that. And we know that that's a continuous process improvement, is keeping communication open and making sure that we're communicating across department lines and across every area of the organization so that we can provide better patient care. 2.3, establish and develop an education and department for the entire organization. And we felt like we completed that goal last year and are pretty proud of the education department and the great job that they're doing for each of us in the way of organizational education. And the last one under people is medical staff leadership and development. We felt like we got about halfway there. As you know, we have made an offer, and Dr. Kirk has accepted to be our CMO, Chief Medical Officer. So he doesn't start officially until the 1st of August, which is just next week. So we're not quite there yet, but we're really close to meeting that goal. And that will be a continual medical staff leadership development. We're working on new contract templates for a lot of our providers that will include things like ACO participation and quality improvements and those kinds of things. And our providers will be working with us to develop those new contracts. The next item is under communication. To develop and execute a strategic public relations marketing plan. We felt like we developed that plan. As you know, Jordan Peep came on as our marketing director this past year, and he's done a really good job getting us more organized and improving and building upon what we already had to have a great public relations plan. The next item is improve community trust as measured by increased patient volume in targeted areas. And we didn't quite reach 100% of that goal, but we made some good progress and have targeted and understand some of the areas we need to put more focus on. And I think we'll continue to tackle that goal in the coming year. The growth area for our strategic plan last year was expand services to the community. We actually didn't quite get to 100% on that one, but we have added additional family medicine down in Fane and Alpine. We opened our urgent cares this past year in Alpine and Afton. And we're offering additional services like pain management with Dr. McClure that began in earnest this past year. So we have come really close to achieving that goal of expanding services. Develop a facilities master plan. We didn't get very far on that one. That's a pretty expensive proposition, and we have honestly felt like we needed to make sure we had the funding to fund that. And not that we're not thinking about it, we've put a lot of thought into that, but to actually get a firm here and go through the process of a master facilities plan is a pretty expensive proposition. So we're going to wait until we have the funds available to do that. The last one on growth was a community health needs assessment, and we did accomplish that. Again, this past year, we kind of put ourselves in a requirement that we do that every 3 years, and this past year was a year to do that. And lastly, sustain viability of Star Valley Health and maintain financial viability. And we felt like we achieved about 79% of that goal. And as you can see from the financial report that Tori presented, that we fell a little bit short of our goal this past year from a financial health of the organization standpoint. We're very healthy still, but we didn't reach our our revenue and volume goals this past year, and frankly, our financials showed that a little bit. It's not due to, I mean, I think all of you probably feel a lot like I do. I haven't worked any harder, at least I don't feel like I've worked any harder here at Star Valley Health than I did this past year, but just to circumstances that access to providers, which we've made corrections on, a little bit of volume down on labs and radiology and in the clinic visits, or we're down a little bit this past year on that. So we're looking forward to a much more robust year this coming year to make up for the areas that we weren't able to achieve our goals in this past year financially. I wanted to provide everyone with a little bit of a summary from board meeting. Oh, and let me go back to one here, and I need to share this with you. Expand services to the community. As you know, we had made an offer, and the offer had been accepted by a pediatrician to come to Star Valley Health. And we've been really excited about that. And I'm sorry to say that this past weekend I received a call from the doctor who was going to come to Star Valley Health, and she and her family had made the decision to not come, to stay in Tennessee where they are and where she is practicing currently. So as we discussed this in leadership meeting as well as with the board yesterday, we feel like it's appropriate for us to continue the search for a pediatrician. We don't think it would be appropriate for us to say to the community, oh, never mind. It's the right thing to do. We're going to be pretty paced about. We have several candidates, quite frankly, that we interviewed previously are still super strong candidates, and they had expressed that they have an interest in Star Valley Health. So we're going to make some contacts and take an approach of being careful about it, but we know that pediatrician is really important part of the medical staff and community for Star Valley Health and for the patients we serve. So we're going to move forward with that and try and find somebody who will stick and come to Star Valley. Just wanted to make sure you were aware of that. So let's talk about board meeting just a little bit. I guess a couple of the highlights. We did cover with the board our strategic plan and where we wound up with our strategic plan and goals this past year. Another item that we spoke about, of course, was the Alpine project. The financial picture for the last year is very prominent in everyone's mind and on the board's mind, and yet they have expressed a definite commitment to increasing our presence in Alpine from the standpoint of providing more services there and additional provider access to the community there, and frankly trying to capture more of the market share that we may have lost the last several years. So we as a leadership team have been tasked by the board to figure out a way to continue with the project, but maybe look at it in more of a phased approach where we would start with, say, the clinic and get the clinic in place, and then figure out the right timing to put in outpatient surgery, and then in addition to that, the right timing to add additional services like therapy, other specialties, and then eventually, a number of years down the road, I think Alpine is going to turn into some sort of it would have an ER, it would have additional radiology, it would have the potential for inpatient beds, it can actually turn into a hospital at some point in time in the future. So the board has asked us to look at more of a phased approach for Alpine, just because they want to be cautious, and we as an organization want to be cautious to make sure we maintain financial health and future opportunities to create growth not just in Alpine, but in other areas of the organization too, and make sure that we're financially capable and able to do that. So that's the board's approach to our Alpine project. Yes, let me have a question, Bruce?
Yeah, what was the feasibility study turnout that was done? What did it turn out?
Oh, thank you. You know, honestly, we had, Navigant is a company we've worked with, and they took our financial pro forma, what we thought we could do. Chad developed a pro forma for us, and what we thought the picture looked like in Alpine, and we asked this company to validate that for us. And they took it and they made a few minor adjustments to what we thought our projections were, and they added some information to it, and we still feel like we're pretty well, and they validated really what we were thinking in a way that they made some suggestions to us, frankly, regarding, are you utilizing your current ORs in Afton at the hospital at 100% capacity before you add ORs somewhere else and add the expense of additional ORs somewhere else? And so we're considering all of those things to make sure that that we're doing this in a way that's not going to put additional burden on the organization, but will improve revenues and volumes and not just increase expenses. So we're really trying to take a close look at that. Thanks for bringing that up, Bruce. We did have this company look at it, and they've come back to us and pretty much validated with some suggestions. Some were, we think you're thinking too rosy in this area, but we think you're, and then they came back and said in another area, we think there's more opportunity than you have put in your pro forma in another area. So it was a good opportunity for us to hear that feedback from them and kind of validate what we're thinking about doing in Alpine. Any other questions about Alpine? Let's see, what else did we talk about? I mentioned to you about our pediatrician already. I think those are probably the highlights that were covered in board meeting yesterday. Announcements, just for your information, don't forget the employee picnic, August the 19th from 4 to 7 at the fairgrounds. Also the Play Unplugged, August 26th, that summer end party for all those who participated in Play Unplugged. And then of course all staff meetings on August 28th next month. So, anybody have any questions or comments? Nolan?
How's the Play Unplugged been going this summer? I haven't heard too much about it.
Kelsey, can you
I'll
report for
answer
us?
that. I think it's going all right. I don't think it's going as well as it was last year. Like last year was super robust and everyone was participating. I don't know that it's as much this year, but I think it's still going strong. I think there's still lots of participation, lots of kids doing it. We had 40-something badges. I want to say 42 badges that were sponsored for this year, so right up there with last year. I think it's okay. The website that we use for the Play Unplugged, that's by the founders, it has some glitches that I think have been kind of frustrating to people, and I think that's part of why maybe it seems like it's not as robust as last year. It's just technical problems, but I think overall it's going well.
Well, I have to say, I was in a business the other day, and there was some kids in there to get their, whatever you call them, and they were out. And
Yeah,
they
see, that's
couldn't
part of the
get
problem the
any more.
website's been having, is the businesses have
Yeah.
had a hard time reordering badges, and so we've had to facilitate that a lot more than we did last year. So, yeah.
Okay, thank you. We are right on the hour, so thank you very much. Appreciate your, Eli's gonna do a drawing for us. Thank you, Eli.
We have
Can't forget that.
three people, and I guess she didn't give others. I'm gonna draw three names, and first person gets the first pick of what's up here, I guess. Veronica. if I can grab my name right here. Sam Page. Liz. Thanks for coming, everyone. Appreciate it.